say this joke, and I'm sorry to my parents if they're listening, but I would say, like, we gave my parents the internet, right? And they had no training on critical appraisal. And so them, like, the Gwyneth Paltrow website seems just as reputable as Harvard Health. And for a long time,
or
it was
more,
a much prettier
like beautiful
website.
Pictures, and she's pretty and vital. And like, of course, everybody wants to like make breakfast in this huge, beautiful kitchen. And like, that association is strong.
Very strong. And so, but without that ability to discern, what goes into making a medical decision, we were being, it's a setup, right? When we have access to that level of information, but not the tools to understand how to interpret it.
Welcome to Influence to Death, your guide for navigating the wild world of wellness influencing.
Okay, so we're talking, but welcome to Influence to Death. My name is Victoria LaFon, and I am here with Dr. Jordan Robertson. Hi, Jordan.
Hi, Victoria.
Hannah is not here today. Her little one is sick, so I have Jordan all to myself. So today what we're going to cover is Dr. Google with a real doctor, Dr. Robertson. And we are just chatting, so we went ahead and hit record because why not? It's so meta. This is the age of what we're in, but we're going to try and untie this knot of really, I think of it, and I don't want to get too nerdy right off the bat, but like, why not? Like basically information sourcing and information formation epistemology in the age of Google. So, but you were sharing something.
Well, I led with, I opened my story with, so yesterday when I was reviewing the history of the Google algorithm, which I think and then I said, like, because we all do this on a Sunday afternoon, right? But I actually think you and I do this on a Sunday afternoon, which is what makes this such a good conversation and such a good pairing. But it's interesting because when I knew that this is what we were talking about, I started with Google because Dr. Google is such a common term that we'll use to, I actually think, describe more than just in getting medical information from Google, because interestingly, Google's probably become more accurate over time, while other channels probably have become less accurate over time. And so I, being the good student I am, needed to reorient myself with like the latest updates in the algorithm so that I knew that I was sharing what I actually experience from a Dr. Google perspective. But I'm excited for us to have this chat.
Yeah, same. I mean, oh gosh. Okay. Jordan, I know you've made notes. I have questions pulled up, and I'm sort of just like, I don't know exactly where to start. Do you want me to just kind of start with the questions that I outlined, or do you have some notes that you feel like are really juicy that you want to, like, you can't wait to like go into?
That I can't wait to say. No, but I will. So we'll start with your questions, but I think first I would just love to frame that, so interestingly, like I'm a naturopathic doctor, which I think sometimes when we hear that term or I have that label applied to me, there is this like automatic assumption about what my relationship with science actually is. And so I think it's important to acknowledge that like my education and experience before and after becoming an ND actually is in the realm of critical appraisal. And so my undergraduate degree was in critical thinking, critical appraisal, and just like inquiry-based learning and understanding of literature, but also decision making. And so how humans make decisions, what influences that. Then I became an ND. Then after that, decided I was frustrated with the lack of evidence-based resources for clinicians that practice more integrative-minded medicine. And so have been back at McMaster University teaching for 15 years on critical appraisal in nutrition and integrative medicine, but also have a clinician-facing resource where we're trying to completely disrupt the practice of integrative medicine by giving people evidence-based standards of care. So when we talk about this is like the deepest, most like important topic to my soul around how we find good information.
That's like how we're going to find each other in the afterlife, Jordan, because we like both believe this so much. Okay. And I mean, I want to shout this out. So your resource is called the Confident Clinician Club, right? I feel like I always mess up the name of it. So is that CCC?
You got it. Yeah. The Confident Clinician.
And would you describe it as kind of like the integrative the integrative option for, what's the one that conventional doctors use?
Like Up to
The
Date would
resource.
maybe be the most
Up to Date,
common.
yeah.
Yeah. And really, it came from my frustration that integrative practitioners really didn't have a place to go. Up to Date is wonderful. I have an Up to Date subscription. I'm a super fan of Up to Date, but it also leaves out aspects of medicine that we do have good literature on, unfortunately. So whether that's exercise, whether that's nutrition, whether that's, I use the term behavior medicine pretty loosely, but talking about how to get patients to comply. And that might be drug therapies or might be some other therapies, but habit change and behavior medicine is a term that I will often use to describe like the how of medicine. That's left out in most conversations in Up to Date, although it's an incredible resource for certain things. And what that means is that integrative practitioners were left to do that research themselves. Now, even great conventional doctors, when they leave school, are not great researchers, right? They are great communicators, they're great at decision making, but they're not great researchers. And we hand them the resources they need to be good at their work. In integrative medicine, we don't do that. We take, not great researchers and give them no resources. And so what that's left with is having practitioners bear the workload burden of looking things up themselves, but also it means that we leave not great researchers doing research themselves. So we built an entire platform that supports them in clinical decision making with the same level of evidence that we would come to expect from our conventional counterparts.
I have like 15,000 questions that I want to ask you. As you're like telling me you got your undergrad in critical thinking, I'm like, I've been looking at PhD programs. And I'm like, I just want to go get my undergrad in that. That may actually be my next educational move. I didn't even know that existed. So that's cool to let people know. And if you don't care, like when we're done, would you send me the kind of like the exact degree program? So if people are interested in that, they can, because I'm
totally.
Like, to me, I'm with you. So that's the most important part of what we do, is to make sure that the evidence that we use is as accurate and practical, right? Both of those things have to be together as possible. And I know that that's why you and I connected so deeply, is because we share that. We have like a value around that.
We do. It's like my core value, honestly. And interestingly, so the undergraduate program that I went to, like my absolute hero in life was the man who started that program. His name was Dr. Dale Harnish. And he was just this perpetual shit disturber rule breaker who knew that cramming 300 first-year biology students into a room was not going to create innovators and thinkers of the future. And so my degree is a health sciences degree. But so the critical thinking was under the guise of health sciences, but really what we did was train in decision-making, critical appraisal, communication, group process, innovation, learning. And so, yes, I came out with a couple of credits that nobody understands because, we spent an entire term researching something that, practically doesn't make sense or certainly didn't help us score any better on an MCAT. But the actual purpose of it was to grow great learners, not just, carbon copy medical doctors. So I feel really fortunate because I was one of the first graduating classes. And so we were like the extreme guinea pigs of the early 2000s in this program. But it absolutely shaped who I am as a person. And it made me strive to also be a shit disturber, rule breaker, and realize that we could change the way things were done if we had a great idea.
Okay, so this is off track, but welcome to Influence to Death. It's like the name of the game here.
Segue number 1.
Yeah, it doesn't mean we're gonna, I'm like, how much time do you have, Jordan? Something that has come up for me a lot, I feel like being in a very similar mind space to you and professionally doing something different with that. Like I like got a nutrition degree and my master's, but like was fortunate to have a really incredible mentor to kind of lead me into like, hey, you should maybe examine your biases and like find out where information comes from. And like, could you be wrong? Like to kind of lead me down that road. Shout out Dr. Tim Sharp. Again, like totally changed my life meeting him and having the really like the just major benefit of having him as an instructor. So under the guise of like sports nutrition, but as you're saying, it's like you can have any context where you learn that skill. It could be and throwing pots. It doesn't matter how you learn that. It's a meta skill. And then now I see like, okay, we apply that in a marketing agency, right? So like the whole mission of our agency is to improve medicine, improve wellness. And the thing that we come up against a lot, and I've seen this come up lately because our boundaries kind of have been like pressed against in the past couple of weeks, is that when you are a shit stirrer, or when I say I'm, when I like kind of come into that role where I'm like, hey, there's a boundary here. We can't publish this. We can't support this. Like this looks off to me. People automatically assume that means you're saying that you have the answer and that you think you're right and they're wrong. And there's this like very like dual black and white, like pattern that gets laid down onto what you're saying. And I find myself for years, like probably close to a decade, thinking in this way, having to say like, hey, no, actually, I'm just one woman. I do not have all the answers. I'm not a particularly strong logical thinker. It takes a lot of time for me to like get in the realm of logic. I'm much more like amorphous, cyclical thinking. I'm not linear. All I'm saying is like, hey, this doesn't look right to me, or this might cause harm, or I just disagree with this and I can't support it. And so I wonder if like, do you come up against that? Do you see that? Like, have you experienced that in your work where it's like, I know you enough to know you're not saying that like you're the expert of all things. You're just saying like, we need to take a closer look at what we're putting out.
Yeah, I think, you kind of nailed it there by saying that like, there's a lot of discomfort that comes from uncertainty and disagreement, right? And so both of those things, like we tend to not be very good at if we don't know the answer to something. And actually we see this in medical literature. If we don't know how something works, people won't take it, even if it was like the most efficacious thing we've ever invented. If there is like a fractional thing that's we're like, and then this one step we're not sure about, people will not take it. And we're like, but guys, like on paper, this is the greatest thing we've ever invented. So we don't tend to like that, right? It's really uncomfortable to sit in uncertainty. And you're right. We do tend to take that position. If you question something, or if you say that something's incorrect or doesn't quite add up, that's implying that you do know the answer, because that's kind of how we've communicated in the past, right? Or that's how we've rewarded people in the past. It was like the loudest voice was the rightest one. The fastest answer was the rightest one, right? When truly in medicine, none of that is true. And decisions should be slow, thoughtful, and have multiple answers, probably multiple answers actually, because when we look at something, the same thing from two different perspectives, we often get two different answers. But that's actually not done very well in people in general. And then when we apply it to something that's as emotionally charged as medicine, we struggle even further, because now we have value, we have religion, we have a lot of things that come into that like ethical part of medical decision making, but we kind of sucked at sitting in the vagueness of uncertainty to begin with. And so I think that it makes our job that much harder when we're trying to teach, we'll call them the soft skills in medicine, around critical thinking. It's hard.
It's
because
so funny that it's
really
a soft
would like
skill.
there to be one answer. I know.
Like
I want them to be rebranded as the hardest skill.
Yeah, it's the story, right, of functional medicine that Jeffrey Bland tells, where he went to medical school and they're like teaching A&P, and they're like going and they're teaching pharmacology and they're just learning like mechanisms, but then they're learning like pathology and pharmaceutical. And he's like, hey, what about the mechanism? We kind of like left that behind. And they're like, no, you're in the wrong place. If you want answers to these questions, this is not the place for that. And so he left and essentially started what we now know as functional medicine. That's a whole other story that, the story of functional medicine that we can break down. But like that veer where he was like, I like need some more, background information to understand like why, like this is the decision that we're going to make, in treatment. It is the hardest skill, and it's still confusing to me in any scenario, but especially when people have like advanced knowledge, advanced experience, and they like maybe haven't made that leap yet, which no judgment. It's like, I made that leap because I got my ass handed to me. It's like, personally, my experience with this, I like came into having an awesome mentor and looking for somebody like that because I had been humbled out so many times because what I thought was true turned out to be just not fully true, which is like the theme of everything that we talk about here. And, now we're kind of talking about it from this meta perspective, but it's like, butter isn't just good for you, like raw milk is not just good for you. Like there's all of these like little exceptions and caveats and details, because of course there are, because we're walking chemistry sets. It's like, and this is just in nutrition, and there's this whole other world of health that doesn't, isn't necessarily linked to nutrition. But it's wild to me that people get to that point and it's like, I'm like, have they not had their ass handed to them or like been humbled out or like, in my experience, again, like wanted to get better or want to see their clients or their patients get better. It's like, I think part of it for me was like being in clinical practice and seeing like, oh my God, like I have a responsibility for these people's lives in a way. Like I took that very, very seriously. Or I'd like my skin to clear up. It's like, there's like all these kind of like moments where I hit up against like, if I keep doing the same thing I'm doing now and it's not working, like I'm wrong. I'm obviously so wrong. So I have to like have some other influence that is not what I'm thinking or what I've learned to get where I need to go. To call that a soft skill, yeah, it just seems like completely off course. It's wild to me. So, okay, we can probably just like talk around this for a long, long time. And I think it's a really interesting conversation. But from like a concrete point of view, do you want to talk about a little bit what you found about the Google algorithm? And then maybe we can go into the questions that I have. And
Totally. And when I train clinicians and undergraduate students on search terms, often we don't understand how these things work. I think we've all had that experience where we like talk about a handbag with a friend and then we leave lunch and then we go home and then the handbag is now in our Instagram feed. I think people are maybe like marginally more aware of certain aspects of algorithm and the kind of content they're being shown. But at its like rudimentary level, people really don't understand how search works. And so when I'm training clinicians, we used to use the contrast of Google and PubMed because they were so starkly different in terms of how they would give you information or show you information. That's blending a little bit now because both of them are trying on some AI-based search. But let's go back like, I don't know, 5 minutes ago when they weren't doing that. They actually were very different search platforms where PubMed would just try and give you what you asked, right? And I always use the example of like trying to retile your bathroom. But if you type black tiles into PubMed, it just shows you all the articles that reference black, all the articles that reference tiles, and then the ones that say black tiles. It's not trying to match towels to the tiles. It's not trying to convince you not to do black tiles because that's going to date your bathroom like instantaneously. It's just going to tell you exactly what you searched for, it's not just that Dr. Google is a problem. And truthfully, there's some cool studies on people, getting assessed faster because Google told them to. Like, I think that's amazing. However, you're also interpreting the information you get back through your own lens. And unless we try and unpack that for people, it doesn't matter what Google gives you back, right? You're going to read it in a particular way.
Yeah, there's that meme. I'm sure you've seen it. This like little cartoon guy is like sitting down at a computer and he's like, time to get some answers. And then he like Googles and it's like all these links. And then it's like, first link I agree with. And he's like, perfect. He like clicks on that one. Yeah, it's interesting to think what you're saying. It's like we do have an algorithm that, and this is to me the most interesting part of like this conversation. We have bias, and it's like eternally useful. It is like how humans got to where we are now is because we think in a heuristic. Like we have to have a model to get through the day, and if we don't, we just go batshit crazy. I mean, people who don't have a heuristic are by and large diagnosed with mental health issues. It's like, that is like what allows us not to expend thousands and thousands and thousands of calories per day, trying to like constantly reevaluate what we're seeing or what we're hearing. I think we know now it's like that heuristic is like set up by the default mode network. And it's like really the only ways around it are like psychedelic drugs, holotropic breath work. There's like very few things that can break through that. And it's for a reason. It's like so that we could survive. We evolved to have that. It's really interesting, but it's like it doesn't serve us in these conversations or in these situations where we need like very detailed, balanced answers. It does keep us alive, on the plains 100,000 years ago, but we're in a little bit of a different world now. To me, it looks like one of those instances of mismatch. It's like in some situations today, even I'm sure that bias is helpful, but in others, like when we're practicing as clinicians or we're trying to make a good decision about our own healthcare, we need a tool to kind of like cut that wire and be like, okay, how can I look at this in a different way? And we're certainly not programmed for that. It's the opposite of how we're programmed. So, I mean, that's, to me, that's like what you studied in your undergrad is critical thinking. It's like what we're interested in trying to convey to people. But like, as a doctor, I'm kind of curious, like, that's like the first question on my list is like, have you seen a shift, towards patients being more and more influenced by that? And then, really it's by their own algorithm, like their own bias that's being confirmed by what they're finding online.
Totally. And it was hard in clinical practice. I will say that, like, on one hand, you want your patients to be interested, right? You want them to have leaned into their health. You want them to have some autonomy, actually, because there are lots of questions that they can answer on their own. Like, if I don't want to put mangoes in this smoothie, what else can I put in it, Jordan? That does not require a doctor's visit. Like, just look it up, right? Like, it's fine. Right. Pick whatever you want. And so on one hand, there was like a lot of positivity about that information access. On the other hand, right, it's created a lot of conflict and challenge in medicine. And, it's funny because I think as doctors, like, we don't want to go back to the old days where people just blindly believed their doctor. But like sometimes when you're trying to go to lunch and you are behind and your patient's like, but I printed out these 17 websites that I'd like to go through with you. You're like, can't you just believe me for 1 second? Like, can we please, I mean, if we go back too far in history, I wouldn't even be allowed to be a doctor as a woman, but like just for 1 minute, can you believe me? So it's hard because you kind of want both at the same time. And we want patients to be excited and learn on their own and try and help us figure out what works well for them. Because lots of decisions in medicine are actually personal decisions under the cloak of medicine, right? Like, It doesn't matter what protein source you eat, like, to a point. There's lots of things that you can pick on your own, and it's not a medical decision. It's a personal one. And so giving patients access to that information is incredibly invaluable and probably population-wise improves baseline health, right? By giving them access to information. It's not enough. And we know that if we just give people pamphlets or if we give people websites, it doesn't solve their barriers to access to good health or access to good nutrition. It doesn't solve the systemic issues in healthcare, but it individually maybe equips people with a little bit more knowledge. And even just having short, small conversations with patients do improve long outcomes around certain habits, which is great. But, right, we also don't have unlimited time to dispel every frickin' website that's, out there. And that seems to have become part of a doctor's job, actually, that, you prescribe your patient a particular medication, they go home and do their own research, they bring it back to you, and now they have a lot of questions about it, and now it's in your job description to negotiate with them about whether or not that was the right choice in the first place. And sometimes I had patience for it, and sometimes I would resort to, which are not my finer moments, being like, why would I have picked it if it was the wrong thing? Like, if I truly knew all these other things were right, like, why would I pick that thing I gave you? So it's hard because we don't have great ways of teaching people about how to use the internet in a safe way. I used to say this joke, and I'm sorry to my parents if they're listening, but I would say, like, we gave my parents the internet, right? And they had no training on critical appraisal. And so to them, like the Gwyneth Paltrow website seems just as reputable as Harvard Health. And for a long time,
or
it was
more,
a much prettier
like beautiful
website.
pictures, and she's pretty and vital. And like, of course, everybody wants to like make breakfast in this huge, beautiful kitchen. And like that association is strong.
Very strong. And so, but without that ability to discern, what goes into making a medical decision.
Yeah.
We were it's a setup, right? When we have access to that level of information, but not the tools to understand how to interpret it.
Yeah, Jordan, this makes me think we have this awesome guy on, Dr. Mark Messina. It's Mark. He has a PhD, and his whole focus is soy. So he was on a couple episodes ago because we did a soy episode, and as we're reading the research, he's like the lead author on the most balanced papers we're reading. And I was like, screw it, let's just email this guy and see if he'll say yes. And he was like, he's like this sweet Midwestern, so knowledgeable, so balanced. And when he came on, I said something about like myth busting, and it kind of like ruffled his feathers. And I was like, ooh, okay, what's here? And he's like, there's this thing with myth. He's like, people believe what they believe for a reason. Like you have to like maybe kind of reshape, I'm summarizing his words, but like how you're speaking about this, because like people have fear, or they've heard something, or, like there's a reason that these ideas come about. So it's almost like another one of those both and situations where it's like, yeah, you do want people to be autonomous and like have some answers. And there are times when it's like, they need to be able to trust you because they may not have the skills to differentiate between this website and this website, or it's like, there are times where, points of a treatment plan or research or information is inaccurate. It's like, but like, is it right just to say like it's a myth and to like brush it off? It's like, no, there's a reason that people are afraid, or they think in a certain way. It's like, this is a very nuanced conversation. To me, like the thing that it boils down to in, with working with your clinician is like to have somebody that you trust, that like kind of understands like where you're coming from. Like there has to be some rapport there a little bit. And then from there, it's like, gosh, if there's any way, sometimes I think to myself, like, how do you make it so that people can have just like a little bit of like solid footing around knowing like what is better for them or not? It's hard to even say accurate or not, but like, look, same with my mom and dad. I, obviously like very involved with my mom and dad's health, try to be as respectful as possible. But like, sometimes my dad's like, what do you think about this supplement? And it's this thing that he's ordered off the internet or out of a magazine because the advertising and the marketing was really good. And there's no way to know the quality unless we go through, in my mind, there's like all of these steps to understand like what makes a quality supplement. There's no oversight like there are for prescription drugs or like that. But like, to explain that, like, how do you, like, what do you give somebody as a tool? It feels sometimes like, to me, so insurmountable that I'm like, well, all I can do is like work on it from my little corner of the universe in my marketing agency to make things better. Because I'm like, how do we give people the tools that they need? If something is beautiful and marketed well, that's what wins.
Yeah. And I think that's one of my goals. And I think we share the same goal of like trying to elevate, we'll call it the goodness in medicine, right? We'll just say like, it's very common that like those myths actually have the most, I don't know what behind them, right? The virality around them.
Yes,
and then there's like really great things that don't ever make it to the light of day because they don't have that same kind of wow factor, or they don't have the same industry behind it, or whatever it is. But even I can see it in my own like micro universe where, I could post about a study that, do this and you'll live forever, and it would have like 2 likes on Instagram. And then if I posted a picture of like my kids burned carrots at dinner because I got distracted, and being a working mom is hard, people would be like, oh my God, this is me. And the comments and the shares and so like, even when something statistically is really good, I think we have a hard time connecting with it still, which is tough because really decisions in medicine are just numbers. It's whether the numbers are important to the patient that actually matter. And I think that's always been my like segue for patients and trying to help them understand things like magnitude, to say your favorite word.
It is my favorite word.
Because those things are lost, right? Like when we say something is good or bad or harmful or has side effects, for patients, they need this like context because they don't understand how to think about that in terms of themselves. We're trying to make decisions based on statistics and population data and odds, right? Essentially, we're trying to bet with the patient's health, their money, and their time, right? We're trying to bet with all three of those resources. And the patient doesn't understand how we're making that decision. And so when I'm pulling together an acne treatment and I'm like, well, this takes less than 12 weeks to work. This takes 24 weeks to work, but it probably gets at the root cause. This is the cheapest. You have to wear a mask all day at work. And so we're also going to do this. Like they don't see that we're betting on stats with all three of those aspects of their life. And then they go home and they Google benzoyl peroxide's toxic. And it disarms the entire thing without realizing how complex that solution actually was for them. Yeah. So to try and bring it back to them to say, like, is a 60% improvement a lot to you, or is that not a lot to you? Right? If there's a 1% chance that you're going to have a side effect, but an 89% chance you're going to have an improvement, what do those numbers mean, like in your life? And quite often they have no idea because they've never thought about their health that way. They always imagine that it either works or doesn't. They don't even realize that their tests are not 100% accurate, right? Like those have a sensitivity and specificity that no one ever talks about. Yeah. Every step we take in medicine is a gamble, and we're trying to stack the whole thing in your favor. And so it's not yes, no, or black, white, or works, doesn't work. It's like we're trying to stack the deck in your favor. But they're just numbers. And if a 99% likelihood of not having a side effect is not good enough for a patient, that's their decision.
Yes. And I think to speak to it, I mean, Jordan, you're talking about something that is a really powerful way to communicate. I mean, it's answering my question. I don't know if you meant to do that directly, but it totally answers my question where it's like, how do you help somebody think about this or like approach their questions in a way that is more accurate? It's like, it's not 0% or 100%. And it's like my favorite logical fallacy right now is the nirvana fallacy, where it's like, we want perfect solutions for a problem. So, I mean, that like gets us into spheres where I'm like, I'm not ready to go on this podcast, but like we start to talk about like vaccinations, we start to talk about, like if any intervention, mammography, it's like there is a risk to everything that we do in this life. But if we can like try and like put ourselves on a scale where it's like, is the benefit going to outweigh the risk? And I think the clinician part that is so important that is not yet present on Dr. Google or PubMed to an extent because they're looking at populations, but who is going to PubMed? People are going to Dr. Google. That population specificity is what the clinician, a big part is for. It's like to help somebody suss all that out. So I think what you're saying is really powerful, like just to tell somebody in a sentence, like, hey, I'm thinking about these different factors, and no, there's not anything that is 0% risk. But if it's going to like drastically improve your quality of life, is it worth it to you? We aren't usually communicated with in that way. And it's actually one thing that we've bumped up against a lot in this podcast, which is like, not only are like all of these factors happening that we're discussing, but there's also like this vacuum in medicine where people don't feel heard, or they just don't have access to healthcare, or what they need, or the interventions that they've been told to try haven't worked. So of course they're going to go to these other sources to try and get support. I think that happens. I know it happens a lot. That's like people's number one, like issue. And I think why they turn to sources that aren't their primary medical team. So yeah, what a powerful way to communicate.
Well, it's interesting because we would rather, and even if we try and paint the picture, like if you do this, you have this likelihood of getting better, but there's this chance you won't, right? We're less likely to act on that, even if the stats are like quite in our favor, than we are to like do nothing. We're much more likely to kind of do nothing. If we say, well, this, and I'm knee deep in the acne literature right now. So if we say like, well, this acne treatment improves your outcomes by 30%, are you up for it? You'll be like, no. But then if we like frame the opposite, okay, if we do nothing, you have 100% chance of getting worse. People are like, oh, I'll take my chances, right? Like we have a much harder time imagining us getting worse, but with inaction. And that's the part that's often left out of the mammogram conversation or the vaccine conversation, is we don't talk about the risk of inaction. And the magnitude of that is often so much greater than the risk of the intervention itself. I mean, we try not to do interventions that have a higher risk than the benefit, right? Like just as a general rule, we don't do that. But we have a harder time with that frame, because when we think about ourselves in the future, we imagine ourselves just like this, right? We imagine ourselves with the same symptom burden, the same challenges, the same cholesterol level, just 10 years down the line. We don't have a very good ability to imagine ourselves declining. And so the inaction feels safer than the bet of a 30% improvement, right? And that's hard, because quite often in preventative medicine, which is where we're going to have the biggest impact on public health, is we're trying to convince people to act before there is a super big problem. But we're doing it with interventions that have a small magnitude of benefit when measured year over year, but a large magnitude if we measure it over 20 years. And this is a really hard thing for those people to see and understand, because they don't feel that bad, right, in that particular moment. So I find that really fascinating, that like, often we leave out the part about like, well, what if we do nothing, right? Like what happens? We don't just stay the same. Almost all medical conditions worsen over time, or start to get complicated over time, or the same solutions that are available to you right now become inaccessible because you've worsened over time. So the thing you get offered first is often the safest and the least risky. And if you don't say yes to it 5 years from now, that option is actually not an option. And you have to pick something that's more risky, that has more side effects. Those conversations are missed in these 7-minute health appointments that we all often have. And when you bring in Gwyneth Paltrow's blog, there isn't the space to discuss like complex stats over your lifetime. And so it feels like a losing battle for the doctor, because they're trying to do what they know and what the best of what we have in that moment, but it's coming up against a TikTok, and it's very easy to want to just throw your hands in the air and just be like, all right, whatever.
We give up. I mean, I can totally, I mean, I don't practice clinically, and one of the reasons why is like, it like broke my heart. Not because like I had all the answers and nobody would listen, but because like there is this way where you do see people, they progress in being ill. It just so happened personally, I was in a position where it's like they had tried everything else. I used to live with this guy who was pretty astute in this way. He was like, people would rather change their religion than their diet, so they've like gone through every other intervention. And then finally they're like, okay, well, I guess I'll talk to the nutritionist, and then they're like actually really sick. It honestly, like I remember seeing some clients where I was like, God, it's so powerful as a tool to bring people even just a little bit out of their, their issue, and they've waited for so long. Yeah. The point that you're making in I want to even explain this word to people, magnitude. It's like the size of the effect that you have, or the size of the effect that something has. And we don't usually think in terms, even some people who are really research literate, we're like, okay, it was a positive outcome. But what we're trying, as I think any good clinician, who's really like working to better the person that's in front of them, has a little bit of a mind for the research, they're trying to find the interventions that have the biggest effect, the most positive effect, paired with the least amount of risk of side effects. And that level of subtlety gets lost all the time. We just don't think in that way.
Mm-hmm.
But yeah, and what you're saying, Jordan, yeah, it's very interesting. Like, we don't talk about what do we do if we don't take action. And our brains also, I think about that in an evolutionary lens. We don't work that way. It's like why people don't exercise or eat right today is because they don't think about what the effects are if nothing changes. They do think, well, it's just going to continue how it is now. And it's like, that's not the case. Like you're saying, that's not true.
Yeah, and it's interesting when you're bringing up like magnitude of effect, like integrative medicine can also take the wrong side of that coin too, where we may see a statistically significant change in a visual analog scale for patients with menstrual cramps because now we like ticked the little line like 0.3 millimeters down from where we did 4 weeks ago. And it has like a statistically significant improvement, right? The magnitude was enough that we said that the intervention worked, but it's not that clinically relevant, right? Like the other side of that coin is, does the patient know that they got any better? Or if we take that minuscule change in, we'll say LDL over time, have we shown that it's a clinically relevant endpoint when what we're actually interested in is heart attacks, right? So often we get really jazzed about statistically significant endpoints that are either biomarkers or a biochemical marker that is not been completely linked to a clinically relevant outcome. And then we state that as if that magnitude is super meaningful, but clinically, patients don't know if their mitochondria are any happier. Let's just be real. And we also, if we asked them what they wanted, the outcomes they would say would be something like, maybe not these words exactly, reduced mortality, right? Or live birth rate, if we're talking about fertility. And yet we can get really stuck down in seeing a statistically significant improvement in embryo quality, but no change in live birth rate. And yet now we've like pumped all these supplements full of some antioxidant that is really expensive. And so we can misuse even the positive parts of research if we don't have the ability to contextualize it in a clinically meaningful way.
Yes, it is so, so, so important. I would say it's probably the number one biggest mistake that people have when they're interpreting the research literature. It's like why I feel blessed actually to work with all of these sports nutritionists, because that real world context is so front and center, because either you win or you don't. And that's it. It's like either you improve, your time gets to a point where it's going to make a difference in how you cross that finish line, or it's not. And it's like, there's like a purity there, it's where I like really love it. It's like, they're not working with sick people. They're working with people who are trying to optimize. And so that like ability to learn like, oh, okay, like how this actually applies to the real world. That's all we're doing here. Like the performance, that's it. If we could take that mindset and put it into whoever we're working with that is sick, people's lives would be a lot better. I think also the way that research is done would change. Like it's important to understand mechanisms, and actually we had a really similar conversation with Dr. Sarah Ballantyne came on and talked about seed oils, which is like this huge, like controversy right now. And listen, I've not bought a bottle of canola oil. I'm like, I'm not there yet. I don't know if I'll get there, actually. I'm like, whatever you say, I'm going to let it in. It was wonderful to talk to her, but it's like, she was like, I used to look at mechanism studies, and now I'm looking at studies in humans, like big, like statistical, like conglomerate studies, meta-analysis to see like what is actually happening in real people. That absolutely gets lost. And I would say even in the like functional integrative world, more so, because there is this little bit of like, we need to prove ourselves thing that, and I get it. I totally get that. But it's like, I actually don't care if you can name every stage in the Krebs cycle, or you like understand like methylation pathways. I want to know that like, are you going to get this rosacea off my skin? To your point, like talking about acne, that's like what matters to me, right? And I think that gets lost because there is this way where we need to like feel like okay, we're good enough. And it's like really good enough is like people walking away and feeling better. That's the end goal that gets lost.
I also think in integrative medicine, and this is a little bit of a digression, is that we've never been really willing to admit that our therapeutic relationship or our provider time or helping people with compliance of things that we didn't prescribe actually is a tremendous part of why people get better. And so we've justified a lot of our work through these biochemical and mechanistic type interventions when people have like signed up to see you every 2 weeks for their acne. Do they eat a little better? Do they exercise a little more? Do they change their pillowcases more often? Like there's a lot of things that happen when people have leaned in to working with a provider that may have a positive impact above and beyond the herb that you've prescribed. But we've never been awesome at that. And I think it's partly because the research on behavior medicine was not as strong as it is now. Like now we're like text everybody in the clinical trial and it'll make them take their supplements.
Yes,
like we recognize that people need provider time to improve, that there are these positive fallouts when people are actively enrolled in a healing relationship that helps them do all the habits that we need them to do. And in integrative medicine, it's almost like we've had this point to prove that, well, it's because zinc is a cofactor for this particular enzymatic reaction in the body. And it's like, yeah, but also there's a lot of other positive things working with patients that happen above and beyond your zinc. And I think we can just accept that. Like, I actually think there's enough literature at this point that we can embrace that if you sit with your patient and have great conversations with them, they'll get better. I think that's something we could really lean into rather than always feeling like we needed a biochemical justification for everything that we're doing. Just very problematic when you're a clinician and you don't know what search terms you're looking up. You don't know what you're trying to find. So it's impossible to try and find something that you don't know what it is if you can't put good keywords into that stupid search bar. But also it doesn't give you a lot of like additional answers, right? And so it takes a very skilled person to start to look for trends in keywords and topics and authors and publication dates and looking at the type of study and whether you can like backtrack through a meta-analysis to find some of those original studies. It takes a particular skill set in order to do that. Google, on the other hand, is trying to show you what it thinks you want. And so you say black tiles and it says, did you mean Home Depot? Right? Or you say black tiles and it says, actually, there's a sale on black tiles and there's a sale on towels. And if you're remodeling your bathroom, there's also a sale on toilets. And so Google, even when you're searching something medical, starts to like question the intent behind your search and show you the most relevant things, which is actually incredibly useful if you're searching for something that you don't know what it is, right? I'm sure we've all had that experience where we're like, the meme with the guy who's sitting alone on a park bench, right? Because you want to use a picture in a presentation. Google will find it for you. And it's trying to do the same thing with your health queries as well. So when you type in your list of symptoms or you say best treatment for, it's doing its best to consider like what it thinks you're asking for. Now, if we go back 15 years, that was problematic because the things that were indexed on Google were ranked according to various strategies that Google had created, which was like backlinking and certain keyword terms. And that didn't necessarily take into account the accuracy. So 15 years ago, Martha's blog on raw milk, if she typed raw milk enough times and backlinked a whole bunch of other things on her website, she might show up on that first page of Google for you when you type in what's the healthiest milk. Whereas now Google's evolved quite a bit to try and give you not just intent, but also accuracy. And it's tried to marry those two things in a way that I actually think the results you're getting back on Google are more accurate. We can talk about when that's not the case in a second. But in general, the answer it's giving you back now is better than the one it gave you 15 years ago because it was trying to guess what it should show you, but it also was using an algorithm that didn't place as much value on accuracy and misinformation as it does now, where it's much more likely to show you something that comes out of Harvard than it is to show you Martha's milk.
Yeah, I mean, as you're talking, I'm like, I also hope people, maybe not even hope, but maybe people know or maybe they don't. It's like, this is what we focus on a lot at the LaFawn agency is search engine optimization to try and get the best information to the top of Google. So like this conversation is apropos to this podcast, to our agency, to everything. I'm like, this is perfect. Awesome. I love it. Keep going. I mean, I'll just step in if I think I can add to what you're saying, but love it.
Yeah. And so I would say generally Google used to be more wrong. Now there's some gaps, right? And certainly like, people that are in that functional medicine space right away could probably jump in and say, but is the newest information available, making it onto Harvard Health like the moment it's published? The answer is no, right? Like moving the ship in medicine is very slow. We start to like collect data over time that starts to change the way we think about something. One study rarely changes the direction in which we prescribe. It's very uncommon for one paper to dramatically change clinical practice. There are moments where we
I just want to
like
put a pin in that. That's like really important for people to understand that like just because somebody cites a paper on a podcast or in a video or on anywhere that people are like this paper and it's so amazing, it's like one paper does not have the impact of a body of research that shows a trend. Those are two very, very different things.
Very different.
And people don't really know that. It's like why people tend toward having like a systematic review or a meta-analysis, which are like more like statistical combinations of findings versus just one paper. Because one paper can be incredible. Like you're saying, sometimes we want it to change the way that you practice or the way that we understand how the world works, but we need to see a trend in a direction.
Totally. And there's a handful of times when one paper does change our mind, right? Where you have a rare condition and we're waiting for any literature. When we study something old in a new population and we're like, well, this drug works over here. Let's try it over here. And maybe that one paper would change the way we feel about using that drug in that new population because we already have a body of literature that we were going off. And maybe we were already borrowing that literature for an off-label use. And now we finally have like an original study done in that population. Maybe one study would change our mind then. Maybe we've been waiting for a comparison study that finally brings two things head to head. And now we have like really clear understanding of which one is better. Maybe that one paper would start to shift the way we practiced slightly because we finally have head-to-head data. But for the most part, we're talking about a body of literature, and one paper doesn't change an entire body of work. So it's hard when new studies get published, but Google is indexing reputable websites about your health, and those websites are not going to change on a whim. And so if you feel like you're in that population where you have a rarer condition, or if you're a marginalized population or person in medicine, part of the trans population, if you are in a population that we already have that's understudied, we're dying for a paper about you, but it may not get reflected in Harvard Health the moment it's published. And so you can see where there's like becomes this disconnect and where we almost start to disagree with the answer Google gave you. Google's trying to speak to the masses, right? And so if you are unique and you have a specific scenario that one paper would change the way we treated you, maybe we shouldn't be looking on Google in the first place. But that's where we can get dissatisfied with the answer on Google. It doesn't make Google wrong. It means that it's not nuanced enough for your particular situation. And so like changing standards of care and changing like the top 5 resources on Google takes a lot of time. That can make us frustrated, especially in integrative medicine, where we really want to be able to keep up with the pace of changing medicine. It's always questionable whether or not we should do that. But the other thing that gets missed in Google sometimes is your values or your particular barriers to compliance or your own individual needs that Google can't see, right? So a diabetic patient who is jobless maybe deserves a different answer to the question, how do we help your diabetes, than someone who is affluent, who has Medicare, like all the things that would help support them in their change. you actually require two different answers, and Google's not going to be able to do that for you. And so you can see where like that individualized aspect of medicine probably can't be done by Google, whereas a skilled person would maybe be able to help you discern what of that information is actually relevant to you. But going back to what I said earlier, like Google en masse is probably more accurate than it was 10 or 15 years ago. The absolute shitstorm is social media, because that algorithm's built in a completely different way, and they're not ranking anybody's content based on accuracy. And so what you see in your feed, which you've also biased yourself to see based on the other things you consume, is going to change the answer you get back about your health. And that's going to be less accurate at this point.
Okay. And so, Jordan, I have some questions for you because this is cool for me professionally, because I'm like, I get questions from our clients sometimes that are integrative, that are like we have clients who are like, we're doing copywriting for them or we're doing marketing, and they're like, we don't even want you to mess with the optimization because we believe that Google is just going to shadow ban what we put out. And I'm always kind of like, I don't believe that that's true if the information that we're putting out is like accurate, relevant, spoken to in a way that's responsible for general population, because you have no idea who's going to land on a website, or you really contextualize it. Like you're saying, like, hey, this only applies if you are, you know, a woman in perimenopause or whatever the population would be. But so you're saying that you can see in Google's algorithm through, like, are you looking on like Google's blog, like the Search Console blog, or like they are prioritizing information on websites that they're deeming to be like more legitimate, more accurate, like that?
They are, and they're not doing it that much differently than they were, right? Like it's still like about links back and what have you. And truthfully, when I looked, because I did do a deep dive on this, it's further down the list, right? Like accuracy is, but it's in there, and it probably never used to, right? I mean, now Google's taking a stand on what it thinks is accurate. And so are we always going to believe that? I don't know. Like that's a whole other can of worms. But it's taking a stand on accuracy in a way that it hasn't before. And it made a call out that, you know, I'm going to say reputable sources are going to be shown with priority versus, and it even referenced itself saying, in the past, like just straight up backlinks and keywords often would let something rise to the top of the algorithm. And that was not always giving people the most accurate information. But, you know, it goes on to talk about like trying to interpret context and how difficult that is, you know, for trying to interpret what people think they're asking, you know, and how it's trying to bring you the answer in that first page of Google. I mean, the interesting thing is, and I had written this down as I was thinking about it yesterday, it's that, you know, even if Google gives you back 10 answers, your eye scans for the one it already agrees with anyways. And so, you know, there's the algorithm, and then there's also the way we consume the information that the algorithm gives us back. And, you know, our brain is going to be probably tempted to skip the ad if we feel that way about ads, or it's going to be tempted to, you know, scan for keywords in those headlines that we already agree with, or a purple link because we've already been to that website and shit, I forgot. Like the way we consume Google's results or PubMed's results is biased by our own beliefs too. So they could show us a whole bunch of things and we probably would still pick the wrong website to look at. And so I think we often
agree with.
Yeah, we tend to blame the algorithm, but like we have an algorithm. And
yeah, God, Jordan, I mean, I remember like practicing and getting to a point, you know, whatever, like year 3 or year 4, and being like, oh my God, I just need to like show up for these people. Like I can let go of so much of this, like mounds of preparation and research and thinking about, you know, all of, like you're saying, the biochemistry in this, and just like listen, just sit there and listen. That's it. It is so powerful.
Yeah, the number one feedback I'd get from anyone who ever preceptored with me was like, you didn't really do anything. Like, you didn't really prescribe them anything. And then like, well, we did in the first visit, but like when we set the stage for all the things. But so much of it is habit change and compliance and reevaluating and like all of those pieces. And yet we're like, we almost are ashamed to say that that's what we do. Like, I think that's the most important thing that we do. We know that if patients who are taking medication for their osteoporosis, like get a 5-minute phone call from their doctor halfway through the year, their bone density is better because they comply with the things that they were supposed to be doing. We know that if we improve provider time, that we improve outcomes, and it doesn't matter what the intervention is. I mean, provided the intervention actually works, but you know what I mean?
Yeah.
Whether we're talking nutrition or drugs or supplements or whatever, if we increase provider time, people do better. And yet we always seem to need to make it about something else. And I think that, trying to circle back to Dr. Google, I'm trying to circle back to it.
It's fun. This podcast is for this.
Like what Dr. Google loses is that, right? Is the context, the individualization, your values, helping you feel seen in standards of care when sometimes your particular population or your particular situation is not seen in a standard of care document, actually. And a provider actually allows you to do that in a way that Google never will, or at least it can't right now. And I think that, the negative side of Google is that it may not be as hopeful as it can be if you sit down with someone who's truly willing to unpack your whole health history and try and build you a plan. I think that there's something so positive about that. But for me, it's like, I really want both people on each side of that table, the patient and the practitioner, to have a deeper understanding of how we make complex decisions in medicine. That's really what it comes down to.
Yeah. I mean, gosh, I'm like, ooh, I want you to be my doctor. Okay. I'm looking at my list of questions to see what else I want to ask you. Okay, this is one that I just wanted to check in with you about. Like, do you feel any pull in yourself towards being influenced? Can you feel that when you go on social media?
I probably can get influenced in the dermatology realm occasionally. And dermatology is so freaking tough. Like I said, I'm in this whole acne research phase. Dermatology is hard because of how complicated creams are. And so we have, active ingredients topically that do really great things for acne. Some of them are prescription, some of them aren't. And in dermatology, once we have a couple of good active ingredients that we know are working, we start to combine them with a whole bunch of base creams and different things and time of day. And now it's a gel and this, right. And now they're a combination together. And so it's so easy to digress from the OG research in dermatology. And I don't necessarily think that's a bad thing. But I can get pulled with oh, this is a new cream with niacinamide, or I can get pulled in the dermatology. And I think partly because I struggle with adult acne, that I'm I would really like if there was some magical solution that made it better.
Yeah.
And so I can be pulled in that direction to try a new skin cream. But funnily, the research also looks like that in dermatology, where we know that there's these 4 or 5 key ingredients that work. And then now all clinical trials that are on them are on these nanotechnology versions of them, or mixed with these different ceramides. And it's so frustrating to me, dermatology, because it feels, even reading clinical trials feels like you're being influenced.
Yeah, well, that's creams. Absolutely true. It's absolutely true, because when you start to see the pattern, I used to joke around where it's there are a handful of studies out there now, or I have found, on the benefits of gluten or the benefits of wheat. But it's once people started to see that there might be a detriment, all of the research went in that direction. It's because we're humans. It's we can't, our algorithm is what is actually driving the whole show. We created the Google algorithm. We created the social media algorithms because we have that. It is programmed inside of our own brains. And of course, that's going to show up in the primary research literature. We can't help it.
Yeah, especially around aesthetics, right? That's one area where, and I think it's because those things that we do topically for aesthetics are by nature complicated and complex, and delivering drugs through the skin is not easy. And so we are always looking for ways to keep doses down, but absorption high, and not ruin the skin barrier, but also deliver the treatment. I find dermatology really tough. And so, but I think I can be influenced by like even like a stupid skin cream or different shampoo on Instagram where I'm like, oh, it has no water in it. That must make it better. And then I catch myself being like, Jordan, you've literally spent like years researching this. Like, why on earth would you even tap that?
Yeah. I think it's really cool for you to talk about it because it's like, it's what you do. And it's good for people to know. It's like we all have that pool.
Mm-hmm. Mm-hmm. Totally. Like you do want, and you know, I do want there to be a solution that I don't need to do every day. Like I still have those same desires of like, can I just like do this and, you know, not have to exercise as much or not have to eat as well? Like I would really actually like that quite a bit.
Yeah, oh, totally.
So I can totally see that I want those promises, can like match it with my like extreme logic brain and know that that's not true. But I can be pulled in that direction. Absolutely. Just like we all can. But I think that's also what like, it's a good reminder that bias, have to check your bias like daily, right? Like I've come across like a positive homeopathy trial and been like, I am not talking about that. Like I don't give a shit.
Yeah.
I'm drawing the line that never is making it into my database. And then I have to say it, like, because we deliver all of our content live the first time. And I'm like, all right, this slide is blank. It's reminding me to tell you that there is one positive homeopathy trial out there. I am not talking about it. Go find it if you want to look it up yourself. This is my personal bias, but it's my presentation. So there you go.
I think I told you the last time, you know, my feet are like notoriously my like weak point. And the last time I hurt my foot, I texted my friend just happened to check in who he also has a negative bias towards homeopathy. And he's like, how are you doing? And I was like, I want you to know I hurt my foot so bad that I used arnica and I don't want you to judge me. And he was like, that must have been really bad. And I don't have that bias with homeopathy. Like I found it to be really useful in my life, but I know that he does. And I could just feel him like, you know, just like, I can't believe you did that. I was like, I just have to tell you how bad the injury was because that might help you to like let it in.
That's the test.
You know, I mean, I think it's interesting if we're able to apply the scientific process just in this one way to our own mind, which is like people start a study assuming that they're wrong. You know, it's like that like approach, they basically are like trying to like do the study. They're like performing the study to come out of that assumption versus to prove that they're right. I'm just thinking like I could put in the show notes, you know, like so people can see like the step by step of that, but it's like you basically have to disprove that you're wrong in a study versus proving that you're right. Now, is that a perfect process? It's like, no, we're human. Everything that we touch is, I love the way you talk about it. We have our own algorithm. It's like we have our own bias in every moment. But if we can approach topics from that stance, that's my practice. I guess I can just share that. It's like every time I go into something, I'm like, I'm just going to assume that I don't have the whole story on this. And I can feel in my own self, like it comes up where I'm like, well, you know, like, and like the more educated I became, it's like that did come up more and more. But again, kind of to go back to, you know, the very beginning, it's like, once you're humbled out enough, you do start to realize that there's a subtlety to this. And there is like there's like a complexity that to assume that you've got the answer is just, it's like, it's ridiculous. You know, it's insane.
Ridiculous.
It's like we have to take steps to help people, but yeah, we can't assume that. So, you know, if we had that approach, if we were taught that approach to assume like, hey, I don't have the full story or I might not be right about this, and then to go in that direction versus I know that I'm right, I'm going to prove it. That, I mean, that would help, I think, our whole situation in the world of health.
Yeah. Which I see is different than cynicism. Right. So
yeah,
that's what you're describing there is not the same as cynicism. And I think it can be maybe easily confused. So saying, I'm going to approach reading this paper, imagining that this doesn't work, right? Or this isn't the right answer, or we don't know what the answer is. That's not cynicism. Cynicism would be a bias that it's a conspiracy theory or that, you know, big pharma has put this out, or what. So it's not the same thing. It's this idea that you're open to any of the answers or any of the possibilities and you're just going to look at each step, each process, each part of the study, if that's what we're talking about, with the same, come back to yourself, come back to zero, right? And think about each of those pieces from the beginning, trying to understand your bias. That's how to think about those things or make those decisions versus assuming it doesn't work, because that means that you're making an assumption. It's that you're willing to entertain both possibilities, right? That it does or it doesn't. And it's much more common that we'll approach reading anything thinking we know what the answer already is. And just, you won't even believe how many friggin' typos there are in an abstract, right? You have to read it for what it says or what the face value is. Don't make any assumptions, because there's always a lot of typos. But that's such a skill, because you have to be so secure in yourself, actually, whether you're a practitioner or a patient, to be open to either option being correct. And that's very difficult, but requires a lot of self-assurance, actually. And maybe that's the greatest thing I ever learned in my undergrad, was that whether it's right or wrong, or it's this or that, I'll be fine. I'm not emotionally attached to either of them, so it doesn't matter. And so much in medicine and so much about our health, there's morality, there's value, there's identity. Some people have built their entire careers on the answer, they think. And so they get much more attached to it than, well, just show me what the right answer is. Where I've never approached decisions in medicine that way. I don't care what the answer is, actually. Let's just figure out which one's truest.
Yeah. And to look at Google searches in that way also, it's most people are looking there versus looking at the abstract of even just an abstract. They're looking to see what comes up first when they put their search query in. Okay. I'm looking to see if there's anything else that I want to ask you. How are you doing on time?
I got 10 minutes.
Okay. Let me ask you this. Where do you see wellness influencing going in the next 5 to 10 years? What do you think is going to happen?
Ooh, I don't know. Where do I see wellness influencing going? I don't know, because I think what I would like to happen is some happy utopia where, people have better critical thinking skills, and the things that are on the internet undergo some level of scrutiny at the same time. But it's hard because you also don't want to shut down conversations that are important. And I started treating PMDD before it was a thing, so premenstrual dysphoric disorder, and advocated for patients to have hysterectomy because I knew they were at risk of suicide before it was a thing. And that came from Facebook forums, right? And so I'm completely willing to admit that sometimes when things are when people don't have access to care, when there are conditions that the online space actually creates a community and a network of people that had otherwise been isolated or maybe not offered particular options because of their race, gender, or geography. There is a lot of positive that comes out of the online space for a lot of people in their health. And sometimes that's where the biggest change will come in a particular medical condition, is because a small group of people became a very big voice. And I would never, ever want that to get taken away from people who need a safe space to talk about their medical condition, or who can't access expensive care but benefit greatly from the online space. I would never, ever want that. So the moment we start to impose rules and restrictions, we sacrifice some of the goodness of the online health space. And, I think I'm very much in technology, trying to use technology for the betterment of humans, although we're in a super race over here for it to be up to the detriment of humans. And so how do we balance those two things at the same time, right? How? And probably, I don't know. I'd like to think, maybe romantically, that if healthcare providers were able to be part of that conversation for people, whether that's in some of those online spaces or whatnot. Like maybe that's like this magical happy medium where we don't get rid of the positive things that people get from the online space. Many marginalized people are benefiting greatly. And I think by saying I want it to all go away means that I'm taking something away from them. And people, I guess, could like eat like Gwyneth Paltrow and they're not being harmed as much as the isolation that would come for some of those communities if we took that opportunity away. So maybe on a humanity scale, it's actually net positive. I don't know.
Yeah.
I guess I want people to have better critical thinking skills, right? So that we stop watching the carnivore guy and like we decrease the viewership on some of those pieces that are I think out of all not true.
Paul Saladino has gotten the most like flack from us on like, and we've covered some kooks, but like that poor guy. I hope he just isn't hearing this. I'm like,
I hope he's eating some papaya or something. Like, please just have like some fruit.
Yeah, I mean, I think the thing that I see happening is that people they're like getting more skeptical. I mean, people I feel like are cynical, and I don't blame them for being cynical, but you know, you like even see it memeified now. You know, people like making fun of the like 50-step morning routine and like they're only drinking rainwater gathered in Peru from like, you know, new moon lesbians or like whatever, you know, the story is. It's like people are like, they're starting to like make fun of it because they do see the like level of on it, like almost like ridiculousness that it's gotten to where it's like, they know that it's out of balance. The part that I hope too, that like the critical thinking comes in is like when something like, and this is hard, when something looks balanced online, that doesn't always mean it is. You know, it's like I see some of these podcasts or some of these posts that people make, or I see Google results come back and it's like the bio of this person, like maybe they are a doctor or, you know, they do have this like alphabet after their name, but like the black and white thinking that they're promoting or, you know, the like supplement that it's going to like totally take care of you. You know, it's like, you know, I like, we see this all the time. It's like, even those types of results deserve your critical mind to like, just take a second look, you know, not everybody should have to be research literate. It's like me being I'm not going to ever be a lawyer. You know, it's like when we bought our home, somebody helped us looked over our homeowner's insurance policy. A lawyer. It was not us. You know, it's like, I don't want to have that job. I don't think everybody has to be that specialized, but I do hope that people will just like take a pause. I love how you talked about to like think about things in like more, you know, benefit than risk. It's like things are essentially like Bayesian, you know, it's like to kind of put yourself on a scale versus to think like it's 100% or 0%. Like you have to kind of like see things as a scale, not just like one or the other. Yeah. And then to think of yourself as a certain population, like you've given some really good, I feel like pearls here, Jordan, which are helpful for people. But yeah, I just think like, gosh, even if somebody seems so balanced, so even keeled, you know, it's like, that doesn't mean that everything that they're saying should be taken, you know, as God's law. And that includes us. It's like why in this podcast, part of like how we outline everything is when we're talking about a specific topic, we say like, hey, here's our bias. We are just two people. We have some good education. We want to bring on really informed people, but like we're coming into this with a preset, FYI. So everything we say, you know, you have to take it with a grain of salt. Yeah, I hope that we can start doing that as humanity, but I don't think we evolved for that.
We did not. We did not evolve for mind changing. No, but maybe the next gen will be able to change their mind. Because I think that's the other part that's like, you know, really deeply embedded in that piece is, you know, and one of the things I try and say about the confident clinician is like, this is a safe place to change your mind. It's not usually safe for doctors to change their mind. Right? Like there's so many layers to that piece where you can say, we used to think that, but we don't anymore. Even that, right? Which sounds very heroic, right? To say, well, we used to think that and new research has taught us something new. doctors still get chastised for that.
Yeah,
Or it's like, well, you should have known, right? You shouldn't have given me that old drug. You should, but we didn't know. Like, we did the best with what we had
we
at
used
the
to
time.
give people like heroin and like,
well, that's it, right? Like, you didn't get the leeches. Relax. But
that's going to be a whole episode, Jordan. So hold tight on that one.
I can't do the leeches episode. Unfortunately, I'm not an expert at it, but give me a couple months.
Look
but
at the research
mind-changing piece is important. The mind-changing thing is important because if you can do that, whether you're public or practitioner, and feel safe making that decision, and we've made you, we've given you the space so that it is safe for you to change your mind. That's, I think, some of the most important things. And we always say that at the Confident Clinician, that like we revisit our content minimum every 2 years because we want to make sure that it's up to date, and we like model changing our mind all the time because it's really important for clinicians to see that that's possible, safe, and actually in everybody's best interest. And so I think that's another, big piece of it.
Would you tell people, tell people how to find you and how to find the Confident Clinicians Club?
Yeah. So the Confident Clinician Club.com is the best place to find us. And you can see lots of things there, like our mission statement, all of our goals as a company. You can also try on our search tool as a free trial when you're there to check out our work. The Confident Clinician also has a great Instagram page. I used to promote my own personal Instagram page, but I recently have been completely sucking at showing up as an influencer online. But you can follow me for the occasional post, which is Dr. Jordan ND.
Yes.
Thanks.
Dr. Jordan ND.
Dr. Jordan ND is where to find me on IG. I'm always looking for new people to connect with that are in the research space. And so if you're listening and you're as nerdy as we are, please reach out.
You might get some hits, Jordan. Thank you so much. It's just lovely to see you, and I really appreciate you coming on.
Thanks. It was fun. This is my favorite thing to talk about, and I don't always get the opportunity to, so I appreciate it.
Well, you are welcome to come on anytime you want. I'll see you soon.